John Bonaprise,
Present.
Brett Olson,
Here.
Pam Garvey.
Here.
Here.
William McLeod,
Here.
Reed McKee,
Here.
Steve McNeese, here, Dr. Ernie Luggett.
Here.
Okay, with that, I will entertain a motion
Move
to,
to approve of the agenda as presented.
okay, do we have a second?
Second.
Okay, motion's been made and seconded to approve the agenda. Any discussion? With no, I will call for a vote. Favor, respond, aye.
Aye.
Okay, and opposed, same sign. Opposed, motion carries. Item number 4, approval of the minutes for the April 8th, 2025 meeting.
I'll move to approve the minutes of the eighth meeting.
By Pam, seconded by Brad. Any discussion? No discussion. With that, I'll call for a vote. All in favor, respond aye.
Aye.
Opposed, same sign. And the motion carries. Moving on to agenda item number 5, public comment for 3 minutes, not to exceed 30 minutes total. Have anyone here who would like to speak for public comment? Anybody online? Does not appear that there is, so we will move on. Agenda item number 6, receipt of information from supervisors not seated as committee members. I don't know if we have anybody online. I can't read that far away.
Just Dana.
Dana? Oh,
Just Dana.
no, that's Dana. Okay, hi Dana. Okay, so it does not appear we have anyone there for that. So we will move on to agenda item number 7, which is the public nuisance ordinance discussion and possible action. Sonia, do you want to get us started on that?
Yep, I do. Okay, so last committee meeting, we had presented the red line copy, basically just dropping the nuisance section of the ordinance. There were questions on it. There were good questions on what that all entailed and some conflicts between the human health hazard and the public nuisance piece of that. So we met with Supervisor Garvey like the following week, maybe?
Something like that.
To talk through it with our environmental health team and what the conclusion that we had decided and presented to Administrator Norby was to look at the ordinance in its entirety and do some cleanup because there were some other things in there that needed clarification on it. Supervisor Garvey, you can correct me if I am.
Absolutely. No, we started going through some of my concerns and then you had just said, if we're in there, let's do it all, and Mr. Hobbs specifically had said he'd done some work on it in the past, that there was more than just the highlighted concerns that came out on the public nuisance. Generally, there were some other concerns.
Yes. Yes. So if we're going to do it right. Mentality. And then we had talked about an ad hoc committee. And that's what we proposed to Administrator Norby. So you met with Corporation Counsel and decided that we don't need that,
We don't need a committee on that. We can work directly with Pam, can work directly with Brian Hobbs on concerns and then bring those further changes and then bring them right back to committee again for that versus a special committee.
So just a kind of you were recommending
work
just a
Just a
work group,
Just a work group working with staff to make those changes.
and then it would go to
Then it comes
that
back.
committee and then back to would have to go to public hearing at that point.
Correct.
Is there any benefits one way or the other to do it ad hoc versus just a work group? Does anybody feel strongly about that one way or the other?
I think a work group is much easier to work with versus opening that door to any change of an ordinance, creating a special committee to do any special changes.
Oh, sure, past practice is, yeah, I understand.
So the committee will get a chance to look at it and, and talk about it before it goes for public hearing then.
Absolutely.
So could please clarify again, so the difference between a work group and an ad hoc? Please clarify the difference.
So I can jump in there. Essentially, if you create an ad hoc, this committee would have to create or the board would create a separate committee whose job and sole job is to look at the human health hazard ordinance and modify it. Basically, a work group is you as a supervisor have asked Administrator Norby whether it would be all right if you worked with staff to develop and modify an ordinance that you have a specific concern about and that you think can be addressed in a particular way. And staff is working with you to make sure that those concerns are addressed. So an ad hoc committee is a committee, whereas a work group is you working with staff to try to get things accomplished. There are benefits in that you as an individual board member or supervisor want to get something accomplished. And if the administrator is willing to allow you to work with those staff members to facilitate that, then that's great. And then the committee, this committee gets to look at that work, look at whatever resolution you bring forward to make that change, and then implement that change and talk about whether it's a good idea or bad idea. It's arguably a faster way to get, if it's legitimately just your concerns or maybe even two supervisors' concerns addressed quickly, rather than if you have an ad hoc committee, okay, well, the only time you're going to be allowed to talk about it is when you're in committee. Things are going to have to get directed to be modified by staff, and then staff brings it back to that ad hoc committee, and then that committee addresses those things. Where if it's just you working with staff, you're going to be able to, you can interact with staff all you want. Because of the open meetings law, you can't interact with other committee members about moving legislation forward for fear of a walking quorum and stuff like that. And so it's arguably a faster way to get things accomplished.
Thank you.
We've had,
Yeah.
we've had enough. I mean, this has been going on for a long time. I think we've had all the public hearings that we need. And basically, an ad hoc is turning over back over to the public. And it's our job now to work that out because we've had all the public information we need. And as supervisors, you know, the public can contact us. Hope we get it done.
To date, though, we haven't really had any public input so much on this because this was originally set up to remove what they've considered duplicate language. And then we had concerns that it really wasn't duplicate language. So then that's what opened up. So none of this has actually gone to the public at this point.
Previous board, we've been working on this for years.
Okay.
So as I understand the process then is that the work group would work together and then it would come back to this committee for a review and then public hearing and the county board. Is that correct?
Correct. Yep.
Procedurally, so there's still opportunity for public input
Absolutely.
along
And
the way and for input from this committee and then the county board as well. So
nothing stops if Pam's resolution comes to this committee as a proposal and this committee says, you know what, this is something that I think that we should create an ad hoc committee. That at that point you absolutely can. You know, we need more eyes on this. We need, you know, Pam might have interests that not necessarily everyone agrees with. And maybe we don't as a group want to address this issue, but we can create a committee that will specifically address the issue. And then you can do that.
Okay.
So there's a lot of steps between Pam presenting a resolution that she wants to see get passed and it getting passed.
So do we need to take action today? Brad, go
So
ahead.
I don't know, I guess after 8 years on environmental services, I'm going to say this seems a little different to me because I've spent 8 years going, you know, literally through this line by line as a committee, not as a working group, and seeing what the committee wanted out of it, not necessarily what, you know, one or two individuals on the committee, you know, calling Tanya or Mo or whoever it might be and saying, here's what I would like to see changed. I guess I'm a little more used to of the committee going through it itself, sitting here and working our way through it as a committee, not necessarily in a day, but over the course of time, if that's what it takes. You know, because I just see that's, at the end of the day, when it comes back to the committee, I think the committee is still gonna have a lot of those same questions once it comes out of the working group. That there's still gonna be a lot of questions of, okay, why did, you know, section 16D(B) changed? That's still gonna have to be answered because it got changed. You know, and I don't want to say like behind closed doors, but you know, in the working committee, it got changed rather than with, you know, all of us sitting here in the room. But I mean, I'm fine with it. I'm fine with the working committee.
So the slight difference here is a lot of times in environmental services, the staff will come with proposed, like, the staff will know these are things that we need addressed. These are the things we're proposing that get changed. These are the things that we're looking at that we have concerns about because in our day-to-day, we're seeing problems with this. In this particular situation, we aren't, the staff is not necessarily looking at the human health hazard ordinance and saying, these are our proposed changes. In this particular circumstance, this is a supervisor who's saying, I've looked at this. This is how I'm hearing it's impacting people. I have a specific concern about this ordinance and how it is interacting with the public. As a result, can I work with you, staff, to find those preliminary things that staff would normally bring to the committee and say, here's the changes we want. We don't even have the changes we want because we aren't the supervisor with the concerns. So it's more on the front end of that whole process. I'm not saying that one way is better or not.
Oh, me either.
I'm just saying that it's an alternative way to get those concerns at least down. Hey, here are the things that we know are issues, and then bring it to the committee. Here's issues that I want changed and how I want them changed. And then the committee talks about whether those are good ideas, bad ideas, or otherwise.
To clarify.
I think it's just one more pre-step before the committee gets the red line version to say, why is this changed and why is this changed? So.
No, I'm fine.
One more opportunity for discussion.
So we've got the red line. We want it changed. Human health hazard has needed to be updated for a long time. We've got proposed changes that the staff are working on currently. We're just adding a supervisor into that because of the concerns expressed at the last meeting. So we wanted to discuss with Supervisor Garvey. She's now been pulled into that group, I guess. So it's no difference than environmental services where we've wanted it rewritten for a long time. It's an opportunity. It's ordinance season, I guess, at the county. So we thought it would be a good opportunity for us to make those updates.
And similarly, supervisors will tell staff, hey, I want you to take a look at this in zoning. And hey, I'm hearing a lot of concerns about this in zoning. They often make a note and then later it'll work its way into one of those red line versions. So it's more of a pre-step than an actual step than anything else. It's essentially just a supervisor working with staff on the part that staff would normally work on by themselves.
And I think between environmental and zoning and this committee, this has been on our agenda for about 8 years.
And nothing stops this committee or the board from creating an ad hoc. Nothing stops you from doing that. If you want to, you absolutely can. It's just we don't even have a proposed resolution to.
The nuisance part comes up from time to time through this committee. I think the last time we did it was about 3 or 4 years ago when it was initiated by County Board Supervisor Nelson at that time, I think, who wanted a separate nuisance ordinance written outside of human health hazard. I think that was, if my memory serves me correctly. So that was the last time that it got brought through our committee here. And I believe Environmental Services was also involved at that time. Oh, yeah, they were. Trust me. Yeah, they were. Bob was and Vince and a few other people. So, and I don't know I'm not sure if that was an ad hoc at that time. I can't remember if it was an official appointment or not. Here we are. So.
Well, Madam Chair, there's so many changes in the laws of what we can do and what we can't do. And that's one of the basic reasons why I think we haven't got it done.
So are we looking for action or a motion to address this in the work group manner at this time, or we don't need to do that, or what do you think?
It says possible action on the agenda.
Right.
Action.
Yeah, it says, there's no action required.
Just kind of information. This is the steps we're at right now, so we should have something coming back next committee.
Does anybody else have any other questions or concerns about it? No? Okay, it looks like we'll move forward again then with the work group and,
The work was wonderful. Thank you.
yes. So we will move on to agenda item number 8 then, which is the report from our crisis ad hoc committee.
Speaking of ad hoc committees.
Yes.
So moving along with the May 23rd Crisis Summit,
Yes.
we've invited the Western region and Northern region of Wisconsin. So basically 29, Highway 29 and above, but in our Western region group, it goes all the way down to La Crosse and Monroe counties. So they are included. I doubt that they will attend just because La Crosse does its own thing. They've got 120,000 people there. They can do that, the crisis stuff on their own. They've also got a major medical system or two down in that area. So so the Crisis Summit is scheduled at the Northwood Tech College in Rice Lake on the 23rd from 12:30 until 3. We'll have a presentation by some of the human services directors and some law enforcement partners to update the legislators. There's an active sign up genius right now, so if you're interested, we encourage all of you to attend if you're able. If you need help signing up, just let me know. I can get you guys signed up. And then if you need transportation, let us know that also. We'll load up some vehicles and get you guys over there.
Quick
Rita?
question. Is that available to observe or participate on Zoom or?
We are working on a Teams version. I need to connect with the technical school to see how that looks and how that works. But I believe one of the legislators is requesting a remote.
Yeah, that would be
I mean,
great.
I'm holding out to the very end because we really want people present if possible, but that request has come through the legislators.
Tanya, could you keep me in the county clerk's office informed if we're going to have a quorum of our attending there so we can get that noticed if we do?
Correct. Yes. So if we have Supervisor Olson, Chairman Luke, and you, we need to have that notice of potential quorum, right?
Yeah, I'm going to
Just one quick question. Timeline, do you need, like, is there a deadline that you need to know when people are coming by? I mean, obviously sooner would be better, but
I mean, if you showed up, we're not going to kick you out. So
got it. Well, I get that too, but I mean, is there? just
yeah, I think we have room for up to 150 people, but
Okay.
keep in mind, we've got 31 counties with legislators, county administrators, county officials, human services directors, law enforcement
Right.
partners. Yeah.
All right, thank you.
Yeah, I would really.
Looking forward to it.
So with that many people in the room, how are you gonna try and keep it contained? Because at the end of the day, I want to hear from the legislators of what they're looking at doing as much as anything, because they know what's needed and they know what has a chance to, make it through the legislature to the governor's desk. So I guess that's just my ask, that we give them more than ample time. I mean, I think, they've all, from the legislative side, they've all seen enough reports. Everybody knows how bad the situation is. So there again, I'm looking forward to hearing from them what they think can be done.
Share. Ad hoc. Brad? So Brad, because you're the chair, you get to recognize people for when they speak. So you get to direct.
You got it. It's to your own question there, Mr. Olson.
I don't usually make these meetings.
A little bit different
Better
than
believe
that.
this one, you're sure.
So when you recognize people to speak, essentially the rules in the committee are quite a bit looser than they are at the board, which is why we have most of our work get done in the committees. You can recognize the same person repeatedly. You can recognize people back and forth so that there can be a little bit of more of a conversation, stuff like that. So you as the
Shall I
chair.
get Fran's gavel?
Yeah,
Yes, you can take the gavel with
you
you.
can. I'll be
And-
happy to lend it to you.
As the chair, it is your job to control if, you know, there are side conversations or stuff going on, or it's detracting from the meeting itself, you get to stop that.
Okay, well,
So if you would like to get together with me, I can give you some of my 1:30 AM ideas that I had last night of
Those
how
are always the
we
best ideas.
control this group. I'm not going to invite you at 1:30 AM, but I will gladly meet with you at some other time to talk about what I think, how we should structure that. Because it could be
Sure.
quite the group. And the legislators are talkative people and have good ideas.
you even set them up as a panel.
Yeah, okay.
Okay. Sounds good. I'm looking forward to it. If we don't have any more discussion on that, we will talk about agenda item number 9, which is our 2026 budget priorities.
I'll take that one. You know, I've been talking about this with other committees, and basically a time for the committee to start thinking about priorities for the 2026 budget. And sometimes that's not always tangible things as cars or equipment or that, but looking at what our priorities are, and maybe the priority of this committee is to legislate harder for mental health task for money for Western Wisconsin or others. Our budget priorities for the county are a full levy. You know, naturally, keeping our levy stable. Departments looking at extra funding requests that are not a wish list, they're a needs list. Also with that, advocating for more federal funding and how that's working. Our budget priority, try to stabilize that. Flat levy, fiscal discipline, and continue our bonding program schedule to complete our capital improvement projects. And also one of our priorities is taking a deep dive into our health plan and our health benefits. So, and trying to see where the numbers are and how we can react in 2026. And so the time for the committee to think about that is our budget process. Each month we go a little further into it here. So it's a time to, if you want to discuss items now, that's great. Or you want to back next month with different priorities and thoughts of what you want to see in the budget, or what.
I got 2 of them here. One's enough to read.
Oh, yeah.
Well, I have a question on what we had touched base on a little bit last month in our upcoming budget. The case of the person who needed to be committed to Lincoln Hills, and that funding, is that, that's an expensive proposition. Is that going to be part of our budget, or how are we going to fund that?
Well, working with Tanya and her group, we're gonna look at that. Typically, we'll look at that as a 5-year average,
Okay,
not the exception to the rule. Because there might be other factors that if the person gets placed under state care, then the costs revert to the state. So we don't want to overinflate a budget just to have money sitting there. So we want to be fiscally responsible on that. So
okay, good, thank you. We have any other questions or comments regarding our 2026 budget priorities for Mo? Doesn't look like it, so we will.
Supervisor Duncan, Chair Johnson, we are seeing some preliminary numbers coming in with the Fed cuts, so we could bring that back to committee if we have more solid
Okay,
information next month, because there are some potential significant cuts to our department and funding sources. So
yeah,
we can do some explanation on the different buckets that money, the Medicaid money is being cut from, and kind of keep you guys apprised that way. If you,
thank you. Yeah, I know where everybody's kind of waiting to see how all of that is going to shake out. So
Yep.
it will be good to keep us updated and informed.
yes.
That. Okay. Agenda item number 10, BHHS accomplishments. And
That's why I stayed up here.
so
So
just curious what that B stands for. Oh, behavioral health. Okay. Is that it?
nope, it's the Board of Health and Human Services.
Okay.
What you guys are.
Yeah, me and Pam were wondering about that.
Yeah.
Good.
All
Thanks.
inclusive of lots of things. Okay, so we have celebrated the 1-year anniversary of a lot of new membership in this committee. So I think that's an accomplishment in itself. We have Magnifici as a citizen member. We've got Tony Johnson as a county board member, Pam Garvey as a county board member, and Brad Olson as a county board member. In addition to those longstanding members, these guys over here who have been on the committee for what seems like maybe forever, but not quite that long. I'm looking at you three guys over there.
10 years.
A long time. So a lot of institutional knowledge and subject matter expertise on this committee, and we appreciate that. So I think that's a great accomplishment. So throughout the year, 2024, this committee helped us to welcome a new medical examiner. We had a longstanding medical examiner, John Dinnies, who retired after 20 years. Jamie Holscher was hired on January 1st of 2024 as the new medical examiner. She was a deputy for us previous, and she brings a lot of great experience too, and is doing a wonderful job. You also helped us to maintain our level 3 health department status. We went through our 1 through 140 review during that time. So we did maintain level 3 status. Housing, the housing initiative has stayed alive through this committee, and you guys have supported housing initiatives through the revolving loan program. You've supported us with some difficulties in high cost placements. We got in front of you guys quite a few times to update you on potential impacts to our budgets and some of our citizens in the county who were needing to be placed outside of the state or in juvenile detention and other higher level placements around the state and the nation. The budget priorities, which we just talked about. So this committee is responsible for helping us to set our budget recommendations that go to the county administrator, which then gets proposed to the county for approval. We had a resolution, 3 resolutions come through last year. The 24 resolution proclaiming May as Mental Health Awareness Month, which it is May, Mental Health Awareness Month again. 5324 was the resolution to support the increase of funding for nutritional programs for the elderly. That came through this committee. And then 5224 was the resolution to support the funding of community support program and crisis service. And then we also had the one for I missed that one. I don't know, I can't recall what number it is, but for the mental health facility in the county. So that one was also passed up to the county board through this committee. Through that resolution, the crisis ad hoc, mental health ad hoc committee was created. And as you know, we're still working on that with the summit coming up here in a week or so. We recognized World Elder Abuse Awareness Day. We supported some public transportation updates to services in the county through the Aging and Disability Resource Center. We heard the updates from Child Support, Veterans, and Golden Age Manor. I think about quarterly, they would come in and give us their updates. Supportive childcare initiatives with the childcare shortage in the county. I believe Chair Duncanson brought that forward to recognize and support assistance with getting more childcare in the county. And then also the Aging and Disability Resource Center, Meals on Wheels. Support of that as they had the fire and they are moving toward a central kitchen. So I think those are some of the highlights of what this committee has done, in addition to the ongoing work that you do monthly to support us in the divisions and the departments that are under this committee.
That's quite a year in review.
Yeah.
And accomplishments and a lot of work that's been done. So thank you to Tanya and all of your staff and leadership within your department for everything that they do. I know it's the year ahead is going to be challenging as well to see where some of these programs go funding wise and what we're going to be able to maintain and not maintain. So I appreciate you staying on top of that for all of us and bringing that back as well. So thank you. Are there any questions or concerns or comments from anyone on Tanya's report this morning? Okay. Then, satisfaction survey.
So we're doing paper this year just because it's easier. If anybody would like the electronic copy, I can send out the link, but every year we measure the board satisfaction. You, if there's changes that we need to make or suggestions that you have for us.
Well, thank you.
I guess you can complete it in return by the next meeting would be, or
That's it.
it should only take a few minutes, but, and I think everybody's here in person today, so we can do the paper. I believe it's part of our accreditation process or our level 3 process that we are required to measure board satisfaction.
Okay. Good to know.
All right.
So we return these by May 31st, and then at the June meeting, we will review the,
I think if you don't have it completed, bring them by June and then we'll talk about them in July. It's
okay,
fine.
Okay.
Just so you don't make an extra trip up here and send it to me, that's fine.
not a rush, I don't. In other words. Okay. Administrators update.
Madam Chair, just a couple things. The other committees, the ATV intensive use park, has been very successful up there. Last month, April 26th, they had their second annual ATV UTV ride that went through the trails and all that up there. Last year, they had 45 machines. This year, they had 166 machines. Up there,
Wow.
so
Great.
very successful up there. The library committee will be holding a public hearing on the library plan 30 minutes prior to the county board meeting in May. So that'll be right before the county board. We're still working, as Tanya said, with options on seeing what the feds are doing with the Medicaid dollars. We're still looking at that. Daily projects are kicking off in highway facilities and parks right now. Sales tax was up 30% in April from last April.
Wow.
Overall, year to date, we're up 11.2%. So it's a pretty good sign right there. Positive impact on that. Another success story on taxes was the Greenway property that was delinquent in their taxes, about $1.8 million. They'll make their last payment in August and they will be caught up.
Wow.
So it's a great success story there. And that's all I have right now for my report.
Yeah, what's the Greenway?
That's the biodigester and.
That's the biodigester in Turtle Lake.
They've been under a county loan. 5-year plan, was it?
Oh, and I got one more too. As a request, Supervisor Olson requested mandated services for community services division, so not for discussion, but here's your information. It's part of a larger document where it's just continuing to update, so we still have a few more chapters to do.
Yep.
Thanks, Mike.
Imagine this might be subject to change as well.
Yep.
Mandated services?
Yeah, at the federal.
These are state
Well,
mandates.
they change
That's all.
statute, so that might take some time,
Okay.
100 years or so.
Good precinct.
Okay, so thank you for putting that together for us. So update regarding the ADRC commercial kitchen project.
Met with Nicole last month and had a discussion. She's new to her role naturally and getting her feet into the ground. Going through the numbers, so we continue to look at our options. And again, I'm gonna be working with Dana also on the option of utilizing GAM's kitchen down there to see if that'll pencil out as one of the options, so. We're still working at it right now. I just don't have any data for you at this point.
Which place are you waiting for data? I'm sorry.
I'm gonna be working with Dana at Golden Age Manor to see about their commercial kitchen
Oh,
and see if it's possible to run meals out of there
oh, wow.
and if that'll pencil out or not.
Okay. It's a little south, but
It's at the Golden Age Manor.
Oh, Golden Age Manor.
And that one.
So just curious, have you talked to Dana a little bit? Is it a possibility? I mean, is it something, or is?
Yes, it is a possibility. She had just hired a new staff member that had some experience in commercial kitchens and doing that, so giving them time to get in their current position, and then we're gonna look at that.
Fabulous.
I was there Friday and met with her on Friday and some of the stuff that. I think that's a good possibility.
sounds promising.
Yeah.
Okay, do we have an update regarding housing
We have no new applications to date.
applications? Okay. And 15, communicable disease report. Helen?
Sure, the respiratory illness season is winding down, which is a good thing. Overall, our COVID hospitalizations were down compared to 2023 season. Influenza hospitalizations were up and RSV hospitalizations were like status quo. We are still continuing to get new pertussis cases. We've had 2 new cases since April, so that gives us all the way up to 20 cases total from November 2024 when we had our first case to today. Overall in Wisconsin, we've had 311 whooping cough pertussis cases this year. We are starting to see our first cases of Lyme disease come in. So we've had 6 cases in March and April. And we are currently in the process of working on a tick disease surveillance system. So we are able to have collection vials at our front desk. We're hoping to get them out to the libraries. People can take them home. If you find a tick, throw it in the vial, bring it back to the county. We can send it to the State Lab of Hygiene so they can species identify them and then run tests to see what diseases are out there. We know our tick-borne diseases keep increasing, plasmosis, Lyme's, all that fun stuff. So we're still working out the messaging, the exact like logistics of this whole process, but individuals won't necessarily know the results of their specific tick. Like it won't be tied to you. You might not receive, the health department might not receive that information until the end of the tick season, but at least it'll give us data for like the county and what's going on and where we should be focusing our prevention efforts and like just education in general. So more to come on ticks. And measles, knock on wood, no measles cases in Wisconsin yet, but nationwide, we're up to 1,100 confirmed cases, 3 confirmed deaths. 68% of those are under 20, 96% are unvaccinated, and 13% of those are hospitalized. So something we're always watching for and preparing to respond to.
Any questions for Helen? No, Dr. Lagus.
Well, getting back to the MMR vaccine, I think it came out in about 1965, and the MMR means measles, mumps, rubella. And then before the MMR vaccine came out, initially there was, in 1 year, and I can't remember, I didn't write it down, and I read it yesterday in Dr. Osterholm's report. There were 20,000 cases of congenital rubella syndrome. And this means could be hearing loss, could be any kind of birth defects. So the moms who are not vaccinated, they don't have any antibodies that will protect that infant for the first 12 months of their life. And so it makes these children very susceptible to any kind of communicable disease like MMR that covers. And so I think that I think we still need to, hopefully, we're urging our moms to get vaccinated, during their pregnancy, which isn't too late. And so it's, so I think if you have family members who are expecting, get them vaccinated so they protect their babies. And the other thing that I wanted to emphasize that the Wisconsin State Senate just passed a law that allows extending postpartum coverage for under Medicaid from 60 days to a whole year, and it was passed almost unanimously.
What?
Do you know, has the House acted on that bill yet?
Not that I know of. I know the Senate has passed it.
Yeah.
so. I don't.
It's in conference committee right now, isn't it, Gabe?
It's whose?
Isn't it in conference on the assembly?
I don't know. I'd have to ask you.
I talked to Duke Tucker.
So I think that I would urge you to contact people in the legislature to urge them to pass this law, because I think it's really important support for our Medicaid moms.
I mean, it should pass.
That's what I've read too, that it should pass.
It's a bipartisan issue and the governor should sign it.
Yeah, I would
Well, he
expect
should.
that. I would expect that. And I think the independent nursing bill, you know more about that than I do.
Yeah.
I think it's gonna pass.
Well, if they do everything the governor says that he wants in it and the medical society, what they want in it,
Yeah.
yeah.
That's what I read.
There's a lot of extreme.
I know, I think the medical society and the governor are on the same page.
Well, yeah,
So
they were funding his campaign, so yeah, they're on the same side.
Yeah.
That was a problem.
I think that will pass. Oh, that's basically what I have for today.
Okay, does anybody have any questions or comments regarding anything from Dr. Lagus? Does not appear so. So with that, legislative event report.
There's a lot going on. There isn't in session now, so that's getting finalized. I've been talking to Duke Tucker on some of this stuff that's coming up. Robin Voss, I talked to Robin, and she's really the head of the legislature, and so Chelsea has been taking her place, and I've been in touch with her a few things. Tanya, some of the things that would maybe help in the budget, we know we're gonna get quite a bit of things cut, but some things I've been talking about, some of these mandates, like take this, this Lincoln Hills project. So when we send somebody to the state, I can see where we're responsible for that. But when they determine, to go to one of the expensive places like Lincoln Hills and that, well, then after they make their determination, if we could get a share, it's not really, it's a possibility then that the state could step in and,
Cost share with us.
yeah.
Um,
If we can get, another thing, if we can get rid of some of these mandates, that are expensive in our budget and get a legislative share in some of these mandates, that's about the best outlook that we can have for any help, in our future budgets.
I think the legislation on Lincoln Hills is to remain status quo with the funding. The rates right now at, what is it, 1,700 a day, something like that. Or 1,600, and the proposed July 1st is to go up to 2,300 a day. So that they're advocating for it to stay at the current rates. Because counties, well, they can't afford the current rates, so they really can't afford the higher rates. So I know that that's happening.
I guess it's
got
not really legislative, but I met with Dana over to Amory last Friday, and I went over they had a complete review. They had 3 minor violations, I guess. One of them was in a hand washing deal, and another was something wasn't expired as far as cooling. Just some minor things, but they had to be corrected, and I in about 2.5 hours and went through each item, and then our rep and I had assigned it for the county, which I did. It was kind of a lengthy deal, but all in all, I think Golden Age got by really good. They're really doing an awesome job. We're short, one full staff nurse and, we had some people that we thought they were from the Philippines
Yeah.
that we were gonna sponsor, but now with this new certification, they didn't get a green card or visa to come over here. So that part of the program, which she was pretty excited about. All in all, doing okay.
Thanks for the information on that, John. It's not an agenda item, so I'm not gonna open it up to any discussion. But thank you for the information. Did you have anything else legislatively?
No, nothing else
Talk about-
right now. I'm sure hoping that we can get rid of some of these mandates and get a cost sharing.
Okay, subject matters for our next meeting. So first of all, we'll look at our work plan and see what we've got on there. For June,
Then will be next year for the new committee, unless this committee wants an encore presentation, we will give it.
I think we're good. Okay,
Annual reports, we just distributed our annual report. I would think that veterans, child support, and golden age could present theirs. You can bring yours, if you have questions, you can bring yours back on ours.
okay,
That's okay.
sounds good.
But
Did you want to discuss any of the mandated services next month?
No,
No? Okay.
Can I ask just one quick, I know it's not on agenda item. Can I ask a quick question though about this? That what you've got listed, these are, I see, yes, these are mandated, no, they're not. So this is in theory, technically all the services that we provide. I
No.
would say no. So how did we come up with, and I don't want to get too far out of order because I know it's not an agenda item, but how did this list get established then?
So it basically, like, if you look at chapter 48.
Okay.
We could list out every single requirement that we have in chapter 48, but we refer you to chapter 48.
Okay.
That is inclusive of, and 948, chapter 51, some of the other chapters, all of the chapters that are in there do explain the mandated work that we're doing. There's a couple that are not mandated, like the CCS program.
Yep.
We want to give you some education on why we included that.
Okay.
So we can give that to you next month. We do have non-mandated services in our division that we provide as well. So, but the education around that would be to support the mandated stuff that we're doing to ease the burden on mandated services.
Okay.
So if that's worthy of education and discussion, we can talk about that. But Supervisor Olson is the one who.
You're right. He's the one that brought it forward. That's why I was just trying to, in a quick review, trying to see what kind of where our,
we can put it on the agenda. I'm fine with it being on the agenda for next month.
If you have questions, then that's a good opportunity to, review that if you would like.
This document was first done back in 2022. We were working on it 21, 22, 23, it came out, and now we're just kind of going back through it to update it.
updating it. Okay.
But it doesn't list every, because all the departments are listed in the main document, but it doesn't list every service that we do or provide. Being that some services come with a grant, you do that service and it's done, and
Sure.
so that's probably the core services.
It'll be after our May 23rd meeting, so I would imagine we'll talk about how that went and what we learned there as well. A couple of these things that are ongoing, if we have something to report, why we'll, I guess, need to have those on as well. Maybe the commercial kitchen project and some of those other things. Does anybody else have anything specifically they would like to see?
Madam Chair, Do you suppose that we can, it wouldn't have to be next month, but do you suppose we can invite our medical examiner to either come to the
Yes.
committee or?
We've been tabling her until we get that burial plot ready to go, so we can bring a presentation on the burial plot that we have down at the old Poor Farm Cemetery. So we'll have her, we can have her come, I think, well, is it placed down there yet? I don't know if the headstone has been placed, so I'll find out on that, but
You know, different medical examiners, they work in different ways, and I'd sure like to see, like we have the veteran services, and so she could either be at our committee or county board sometime. Nice to meet all these people.
Yep.
And
The ordinance will be back on again.
It would need to be, I would think.
Yeah, if you have something ready to bring forth, I certainly would expect that it would be.
for which one?
Or
Uh,
the nuisance
The
ordinance
nuisance ordinance.
for next month.
Human health hazard.
Yes, the combining thereof.
And then the budget update.
Rita, did you have something?
Oh, we were just wondering about any reference paperwork for the nuisance ordinance to get up to speed on that. How do we send it to?
Didn't know if anything was passed out.
So it was part of, in our package. There was,
There was something in
some information in there, yes.
This is what was presented last month.
Yeah.
We will be bringing you a fresh copy with lots of red lines
If it's possible to get that
at a time.
ahead of time, that's great. That gives us a chance to look it over a little bit. I know sometimes that's not always possible, but if we could, that would be great. Okay, do we have anything else for next month? Anybody have us on their radar? No, with that, I will entertain a motion to adjourn.
I can move.
Second.
Okay, motion's been made and seconded to adjourn. Any discussion? None. I will call for the vote. All in favor, respond aye.
Aye.
Same sign. Motion carries. We are adjourned.